again, welcome everybody. Very excited to have everyone here. On behalf of the Disability Board from Key Biscayne, we want to welcome you all. We hope definitely this is the first of many summits that we get started from here. And definitely on these focus that we have today is for disability, autism, inclusion, access, and definitely a stronger collaboration among the different boards and different municipalities. So thank you everyone for being here. First, I definitely want to thank everybody in the Disability Board of Key Biscayne. So if you want to stand up and introduce yourself or just say hi so we can identify you. So these type of events don't happen by accident. It was a lot of planification and efforts put in there by most of our board members, and definitely we're excited to be here. We also have today the pleasure to have our Major Roscoe here. So thank you for being here. He's going to say a few words. I also see Commissioner Stoner, sorry, Council Member Stoner, and Sardinas as well. Thank you so much for being here. So I'll give you a second for doing intro.
Sure. Good evening and welcome to Key Biscayne. For those that are not from our fair village, I want to thank each and every one of you for participating in this very important disability summit. The members of the board, they do an outstanding job. Thank you for putting this together. And this couldn't happen without the work of the liaison, Nancy Stoner. Nancy, get up and take a bow. And we also have my colleague, Oscar Sardinas, in the back there, who's also working hard. And today I also have the privilege of introducing a fellow member from the city of South Miami, Steve Calle. Take a bow. It's truly encouraging to see so many community organizers, advocates, professionals, partners that are here together for a shared purpose. And that shared purpose is building a more inclusive and connected and supported community for all of us. Inclusion is simply not about access, it's about belonging. And it's about making sure every person feels valued, heard, and empowered to participate fully in our community and our community life. That kind of environment does not happen by accident. It takes a lot of work, and I know that that's the work of this disability board, but the work of all of you who really are very much a part of our community and making and improving the lives of all of our residents. And this is what today is all about. It's about organizations being represented here, organizations and experiences, perspectives, all these things that we hope that you will share with each other tonight. And this is all about collaboration. We need each other. We need our different organizations. We need our different points of view to bring us together and take us to the next level, because we're here to improve. We're not satisfied with the status quo. So it's really important that everyone asks questions and become part of making our community better. And along with that, we will make other communities better. So I encourage everyone to connect, ask questions, continue creating a community where inclusion is not just a goal, but a shared responsibility and a lived reality. Thank you again for being here and the important work you're about to do. I hope you have a meaningful and productive summit, and we look forward to doing this again year after year. So thank you all for your participation, and thank you for putting this together on our behalf.
Thank you. I also want to thank the rest of the panelists that are going to be joining us today, the municipality partners that came as well as our interpreter today. Actually, there are two of them presenting and helping us today. Since this is our first summit, as I was expressing before, we want to kind of explore elements of how our boards can really serve better our communities. How do we turn our community and recommendations into different elements? Is it kind of here? Closer, even closer. All right. Okay, I can sing something too.
Hello.
So how
Get up here.
how we turn? Welcome.
Well, well, well.
Be safe,
Our
be safe.
very own Commissioner Regalado.
Yes.
Come on down.
How you doing? Good to see you. Oh yeah, one of my favorite humans are hanging around here. Oh, thank you so much. Thank you so much. Sorry I'm late. We were stuck at the county for our mental health, the Lifeman Center, like hours and hours and hours and hours and hours and hours.
Important project.
My former neighbor, Mr.
Yes.
Judge Life.
Yes,
Awesome.
yes.
Well, thank you for joining us, and I'm glad that you were able to make it. So basically, how do we listen better to the needs of the community? How do we partner with agencies, nonprofits, and different organizations to make it better? And at the end of the day, we are definitely honored to have such a great panel today. So we have Commissioner Regalado, Dr. Michael Alessandri from CARD, Jeffrey Brosco as well, which I'm going to give you some time to introduce yourself, and Dr. Jennifer Duroher as well. Some housekeeping elements. Please, anybody that is on Zoom, please mute yourself when you're logging in, as we have the transcript being live, and that will interrupt it, as I was told by our technical team. We have a very full agenda, so definitely on trying to cover all the elements in there. So I first want to start by giving you maybe like a minute or two just to introduce yourself and tell yourself. So if you want to start, Raquel.
Oh, okay. I am Commissioner Raquel Regalado. I am proudly represent Key Biscayne at the Board of County Commissioners, and before that, I was blessed to represent Key Biscayne and District 6 before the school board. And I am the proud parent of 2 autistic adults and a neuro-inclusive advocate for life. And I'm thrilled to be here and to have this conversation with such amazing people. There's so many people in this room that have really changed the trajectory of so many lives, my children being 2 of those. So it's a privilege. Thank you.
Thank you. Dr. Brosco.
Hello, everyone. My name is Jeff Brosco. I'm a developmental behavioral pediatrician, so I'm a pediatrician like any other, but I focus on how children learn and behave and see lots of kids with autism, intellectual disability, learning issues, and so on. I also have a parallel life in public health. So I was Deputy Secretary of Health in the state of Florida for several years, and I worked in the federal government doing similar kind of work, trying to make sure that every child with a disability has access to the services that they need. But today, I'm just Jeff, a Key Biscayne resident, talking to you. I'm not representing any of the federal or state organizations.
Thank you. Dr. Alexander, please.
Ditto. No. I represent nobody but myself. I am Michael Alessandri, and I am a clinical professor of psychology and pediatrics at the University of Miami, where my primary responsibility is as the executive director of a program known as CARD. CARD is the Center for Autism and Related Disabilities. We are one of 7 statewide centers. All of us have our own regions, so all 67 counties in Florida are represented, and any family with a child with autism or related disability can access our services at no cost to them. This is a service that's provided by the state, and our center, which serves Dade, Broward, and Monroe, is currently serving about 20,000 families. And when I started, it was about 200 30 years ago. So I had hair back then. And this is my colleague, Jennifer
Hi.
DeRocher.
Hi, everybody. I'm Jennifer DeRocher. I am also representing the University of Miami CARD Center. I'm the director. I am also a clinical professor of psychology and pediatrics in the Department of Psychology. I've been at CARD since I started as a graduate student in 1994. So I've been in the community a really long time. And some of the other things CARD does that Dr. Alessandri didn't mention is we do interface a lot with community agencies and organizations that serve our constituents so that we can make those more welcoming and inclusive places. And so we provide a lot of technical assistance and training around those particular issues. So happy to be here. And turning it back over to
Thank
Leandro.
you. Thank you. So one of the main questions that I guess we have as a recent created board is how can we better serve and how we can have a better impact through collaborating with agencies, organizations, nonprofits, organizations. So I just put the question in general, but you can start as you wish.
I'll start. So one of the reasons that I've talked about creating these boards and how important they are is because our disability community, unfortunately, works by word of mouth. I don't know what's up with our peeps, but we need to create infrastructure. We need to have a place where people can go. People constantly say that there aren't resources, that there isn't programming, and obviously we always need more, and we're always doing more, and we're always fine-tuning what we have and responding to needs. But there is a lot. CARD does a tremendous amount of work. What I wouldn't have given for a grandparent support group and a parent support group and a sibling support group, when I started this 20 years ago. So I think the easiest entry function of this is to give parents and community a space where all those resources can be curated. And then as an elected official, I think that it's important to have some guidance because as the mayor can tell you, we get bombarded for all sorts of things. And some people have more access than others. That's just a reality of it, right? So what this does is it creates a level playing field where everyone can come, and then what is presented to the elected officials is a little bit more curated, right? And we can also talk about what they're doing in other areas, right? So sometimes I find that cities want to duplicate something, and there's just something down the street, and we're like, oh, maybe you just need to collaborate with this other city, or maybe the county is doing this and you just need to augment it, or maybe someone has done the pilot and you just need to replicate it, right? So those are the things that as a policymaker just makes it so much easier for us to have that point of reference. And you can also help us push out things. I think that as a community, because of our children and because what brings you to this community is being a caregiver, that role can be all-encompassing and overwhelming. So to ask a parent to be an advocate is a lot. And to ask an autistic person to be an advocate is a lot. So structures like these allow us to make that advocacy piece easier to start.
Thank you.
Well, I'll just say, we've had such a beautiful partnership with so many communities, and the work we've been doing with Commissioner Regalado has really been monumental, and we'll talk more about that, I think, as the night goes on. But I guess I want to just highlight something, because I said to you earlier that we have 20,000 families registered with us, and everyone, I think, reacted in a way that was surprised and impressed by that. But there are probably over 100,000 families that need us in the same community. So we need to build, like the commissioner said, more infrastructure that allows us to connect with those families who are harder to connect with, because there are many, many families who access the resources that are available, but those families are already well resourced, right? And those are the families who find the resources much more easily. So it's incumbent upon us to find and build, structures, whether it's, and I'm a firm believer, it wouldn't surprise you, of a university, community government kind of partnership. I just think that you have to build those coalitions in order to really have an impact. And then, of course, you have to create the framework that allows citizens to express what they want, what they need in their communities. I see some friends from Miami Lakes here, and I think just take a look at what the Special Needs Advisory Board has done in Miami Lakes, really kind of on their own, and it's been beautiful to watch it just flourish. So I think all of these disability advisory boards, whether they're special needs focused or broader, I think serve a really important function in highlighting what the needs are of the community and then connecting those communities with the resources that are available. Because as much as we're stretched to the limits with the resources that we have, we would love to be serving even more people, even if it's at a different level, like even not as maybe as impactful a level as we are now. I would just simply like to reach more people and know that the people who need us are more connected to the resources that are in the community. Because as Commissioner said, people still come up to me and said, there's nothing, people say it all the time, there's nothing in the community, there's nothing for moms, there's nothing for dads, there's nothing for recreationals. And I live in this world. So I know we have moms groups and dads groups and grandparents groups and sibling groups and trainings for teachers and support groups for teachers. And, there's so many things happening. But there, as my friend Victor, the autism dad, some of you may know him, will say, it doesn't matter if nobody knows about it, right? So there's opportunity. And I think creating these structures and connecting them like you're all doing today is only creating more awareness. And then I think awareness, as we all know, is only going to take us so far. Action is what's going to get us to where we want to go. So what you're all doing is these are actionable items. So I'm happy to be here, and I think there's an opportunity there's strength in community and strength in numbers, as we all know. So we just have to share the mission and share the lift. It's a heavy lift, all of this work. We can't do it. No one can do it alone.
I want to follow up. Go ahead. Sorry.
I was going to give a particular positive example of collaboration, if that's okay, if we can say some. But before the positive news, I have to also tell you just a little sobering fact that we, as a state, I think a lot of you know the Part C Early Intervention Program. It's a federal state program that says any child with any delay that we are going to do an evaluation and then provide services to that child up to age 3. The national average for per child spending is around $3,800 per child. And there are states that are $6,000, $7,000. Anyone know what Florida is? About 1,100. So one thing to keep track of, right, is that how much you put into a system also tells you what you're going to get out of one, right? So that's one thing. But also, I want to give you a positive example, as I said. One of the tricky things we were finding, and a lot of you probably know this, is that in that Part C program, they would see a child and say, we're pretty sure this child is on the spectrum, and he needs ABA 35 hours a week. We need to start like tomorrow. And the wait time to see someone like me to get a CDE, the Comprehensive Developmental Evaluation, to start, to get the insurance to pay for it, has been about 9 months to a year, right? That's lost time. So one of the things that we did, so I'm at the Mehlman Center for Child Development, part of the University of Miami, work really closely with our partners at CARD. We worked with the Part C program to say, when a child comes through, and you're pretty sure, right, they meet criteria for autism, we have what's called a fast-track CDE appointment. So within a month, we see them. And that wasn't enough. We also worked with Early Steps South, which is run by Easter Seals, and worked with our partners at Nicholas Children's to create the same kind of system there. It doesn't cost a penny more, but for the kids we know really need to get that CDE right away, we've created these fast-track appointments. And so I think it's a great example of collaboration between university, private institutions, or public institutions that just gets families where they need to get a lot faster.
Thank you. And a follow-up question, maybe related to this, is how can we create policy or support the policy to present to those municipalities from the board perspective?
I got a toolkit for that.
My question was
I was hoping you would talk about the toolkit.
Leading question.
Leading question. I got a toolkit for that. So one of the reasons that we did the work that we did at the county was to create these pilots that people could replicate. And that's why the toolkit has legislation in the appendix that I'm like, please copy, right? Just cut and paste and run with it. And I'm always available to talk about tweaking it and other things. And one of the reasons that I put it on a website is so that we can constantly be refreshing it and adding to it. Because as Michael said, there's a lot of work to be done. The fact that we've done what we've done, which is amazing for the short amount of time in which we've done it, does not undo the great need to do more, right? And one of the things that I ask people to do in the toolkit is to use April and October as accountability points. And I've been doing that. I've been going to all the cities, I've been going to counties, asking them, what did you do in April? What are you planning for October? What did you do in April? So it's not just like, oh, I support autism, here's my picture, like autism acceptance.
This meeting is being recorded.
Thank you. It's all good. But also really asking our partners to do more and asking them what their plan is. And that's working. Look, I mean, in the toolkit, we worked with police to do the decal when police was still under Miami-Dade County. Now the sheriff, this year, her April rollout, so we talk a lot about accountability over there, was doing the car registrations. So now you can register your car, right? So that's like, that was the next step. We started with houses and the next step was the cars. So we have to keep building. But to Michael's point, we also have to keep communicating with people to see if these things work and if we need more. I was at our firefighters, we had like the biggest class that we've ever had, 72 firefighters were inducted. And my question was, okay, when are we training them? Right? Because, now you have 72 new humans that need to be trained. So the training is continual and we need to stay on top of it. And that's why, back to the legislation, we really went out of our way not to create new systems, but to embed them in existing systems so that they could have longevity. And that's another thing, try not to make a new thing, try to just tweak the existing thing. So one of the things that we're going to be talking about in October, for example, is when we did KLA, the county was doing the placement. That got a little overwhelming. I only have so much time. But now we have CareerSource doing it. So now we're going to train CareerSource. And that's going to be a model because CareerSource is something that exists in other places, right? So we're constantly trying to make changes and we adapt to figure out how do we make this scalable? How do we make this replicable? Because I think we're all on the same page. We want to Michael's point, we want to impact as many families as possible. And we want to continue to build community. So, there's always a perfect way to do things. I just start like at the do things, and then we kind of work on it until, we get the best product. Because if we sit around waiting for the perfect, like we're never going to get anything done. So in many cases, you just have to get going. And that's what I would say with legislation. You just got to get going.
And there are like great examples already. Years ago, and I know some folks from Coral Gables are here. Like Craig Lean when he was the, huh?
Marty's here.
Okay, good. Yeah, Marty. But Craig Lean, as you probably all remember, really pushed for the city to adopt principles of inclusion, which were really just beautiful statements about just the welcoming nature of the city and what we expect from our citizens in terms of creating a welcoming, friendly city for citizens who happen to have various disabilities or special needs. And so we're the Center for Autism. So we have programming called Autism Friendly Initiatives where we work with cities and businesses to make places and spaces more friendly, but that's applicable to any disability group, right? So I think it's, I always say to people, don't get put off by the label of autism friendly because it's autism friendly because it's from the Center for Autism, but it's really meant to be neuro-inclusive or just disability friendly. And you may not know this, but because of Commissioner Regalado and because of the county, we've been able to do a really broad-based disability inclusion, autism friendly, whatever you want to call it, programming. We have urgent care centers now that are autism friendly. We have museums that are autism friendly. We have art centers that are autism friendly. We have pediatric practices and children's hospitals that are autism friendly, and more and more and more. We have trained over 4,000 first responders. All the 50 plus parks, all the 50 plus libraries have autism friendly initiatives. All the parks have autism friendly social stories and other materials. We've worked with the library. If you go to the airport, and so many other aspects of community life that intersect with our families are now prepared to welcome them. But we still need more, municipalities taking the lead, setting policies, setting expectations, creating a forum where people can share what they need, what they feel like they're lacking. And then you look for partners like us. Florida is blessed in a lot. We don't get enough credit for having had the vision to create a statewide system of care, this CARD program that we're proud to be a part of. It's all across the state, and I would encourage you to try to find any other state that has that infrastructure. So you could create partnerships with agencies like ours, and we can embed that in the work that we're funded already to do. To some extent, we can't do it all, but we can do quite a bit of it in partnership with you, with our collaborators and our partners. So I don't even think a lot of what we're talking about costs a lot of money, really. It's really about just having the right opportunities and the right partnerships and the fortitude to want to make something good happen for your community. You just have to stand up and have some shared vision and shared goals, and things can change very, very quickly. This program we've been doing has only been for 3 to 5 years. If you do the math on it. And it's been hugely impactful.
He needs to finish transit too. That's like the
I
last
mean,
department
yeah.
that he's working on. He's working on
We're not
transit.
done. But
Yes.
We're never going to be done. That's the other part of this. You're never finished because
No,
things
that's
keep,
right.
it's iterative.
Yeah, no, there's no place, there's no end point, but there is a beginning point. And it can seem really overwhelming, I think, right? Because you just heard us talk about all of these things that we did, right? Which one do you start with? How do you prioritize that? And I think that's going to be different for each municipality. And I think, your board is going to drive that with input from your community. What is the most important part to start with, right? There's no perfect time. There's no perfect way, as Commissioner Regalado said. So pick one thing, set some accountability goals. I like that April and October, like what can we accomplish by October? Set a short-term goal, pick one thing to do, explore that website, it's phenomenal, and what resonates for your community, and start with that. Look for your community partners that can help you. We're here to help, and there are many other great organizations in the community that are disability kind of organizations that can be helpful for you as well.
One thing that I would add to that is, we all have a bias, right? And our bias is we love humans who have these issues, right? So I always tell parents, like, hey, remember, you have a bias. So don't go in like fists in the air. Like, you leave that for the school board, right? Like, that's like what you do over there. Like, on your, don't take your IEP self. Like, leave your IEP self at home. Because a lot of times people don't know that our children and our families are being excluded from public spaces. People did not believe me. When I brought the original item and I said, our parents don't go to libraries. If you asked me to meet you at a library, I would ask you why you hate me. Everyone was like, what are you talking about? Everyone loves libraries. Libraries are safe spaces. And I was like, not for me. They're not. They're dangerous. My kid will get Baker acted. So, but those, like, I had to say those things, right? But once we started training people, it was amazing. Everybody all of a sudden, like, got it. They were like, oh, wow, that's a good point. Nobody mentioned to me that this aspect of government was not being inclusive. They assume, and I think it's part like the ADA. I don't know. I mean, people think physical and they think it applies to everything. They're like, well, we comply with the ADA. I'm like, that means nothing to me. So I think that you have to start there, kind of showing them like how this doesn't work for us. I went, to some of our county partners, for events, which is a very easy thing that I mentioned in Toolkit. And I said, look, a lot of our kids can't come if there's strobing lights. It's too loud for my kids. Could you turn them off? And they looked at me like I was nuts. And they were like, but who wants to come to an event that doesn't have music and lights? I was like, I do. So I said, look, just test it out and see, right? Like, turn it off, turn it all off. We can have as much fun without these triggers. It can still be fun. And when it went well, everyone was like, wow, people loved it. We got so many emails. Everybody, was excited, which is the second part to what Jennifer was saying, and Michael. When we do these things, you have to say, yay, thank you for doing the thing. People got to show up, people got to say thank you, because then how do you ask them to do the other thing? Right? So you also have to use this infrastructure to motivate people. And I get it. We all have like crazy lives, and things happen. But that's part of the frustration too, for those of us who do this work. We go through all this effort. We talk people into it. We put our credibility on the line, right? We say, I'm a leader in this community and my community wants, and then nobody shows up. And you're like, all right, try again. But it really is, difficult for us, because we're always trying to say, like, if you build it, they will come, And I have this problem with programming, at the county, because they're like, but the parents don't come, So, I think the other part of this is really getting people to understand that if you don't use it, we lose it, right? So here we are fighting for a thing. You have to go out and use it, because that's how you prove to the stakeholders that, this is wanted and this is necessary. You can't just kind of assume, because then it starts to fall apart.
Yeah, I think that.
No, I was just going to say, it's a reminder to have like a constant flow of information and dialogue with your community, because what they may have wanted and needed at one time may not be what they want and need now. So them not showing up may not be because they're not interested. It just maybe, or they're not available. Or
interested in that thing.
maybe that their needs have shifted. So it just has to be a constant dialogue with the community, and every community is different. That's the other thing. I mean, I'm pretty sure I live in Miami Beach, and I can tell you I'm pretty sure that it's very different than pretty much every other municipality I work with. And I won't value that one way or the other. It's just different. But communities do need different things, and we have to have some way to get that information from them, because we don't want to build things that they're not looking for.
And one thing that even though there are those differences in each municipality, we also believe there are similar ones, and I feel that if we can synergize and we can work together more, there's going to be a better possibility for resolving instead of twice or 3 times the same thing. We can probably make that collaboration. Is there any model that you feel that can be?
I mean, I just want to say that I think the most important thing is that we talk about it, right? Like that the citizens see that people care enough to put it on an agenda, create a disability advisory board, have a forum like this. I mean, that's the kind of messaging that people want. People want to be seen. They want to be valued. They want to be understood. So I think it starts with, that kind of symbolism, if you will, like just opportunities for dialogue. I don't know if I have an answer to your second part of your question, but I feel like we've really done a beautiful,
lot of that, right?
There's a beautiful playbook now that the commissioner and her team have created. That's an extension of the work that we've been doing, and I don't think anyone needs to reinvent the wheel and I think you look at that toolkit, you pick, one priority, and you spend some time really building and refining that particular thing. Because I think, as Jennifer said earlier, you can't do it all at once. What we did took, I don't know how many years, 5, 6 years, probably all in. But
I'm relentless. I mean, it was.
I'm looking over my back now for her all the time because I know more work's coming. No, but it's like you want people pushing, like even as an agency who's stretched to the limits and maybe overstretched, you want someone like Commissioner Regalado and Leandro, who served on our board, to constantly be pushing us to do more, to do better, to be smarter in how we approach the work, to listen to the community needs and create new structures and new opportunities for people to be engaged or feel seen, right? Like it's just really about giving voice and creating opportunities for people to feel connected.
And to that point, one of the reasons that I've been visiting the municipalities is, number one, I want them to have access to the toolkit and to be able to ask me questions. I mean, I mailed it to them, I emailed it to them, and I'm like showing up in person. I'm like, in case you didn't get the memo, I'm here with the toolkit. But I'm also trying to find my people, right? Because when I go and present, inevitably, there will be 1 or 2 that will follow me out and be like, I want to do this work. And those are my people, right? And those are the people that now I need to, be circling back with. Because, you need to also find an elected that wants to do this work and, press on that person to do the work. Because, it's hard. Everybody thinks it's a great idea, but who's going to put in the time and draft it and bring it and put it on the agenda and go to the community meeting? Like, a human has to do these things. I always tell people, I'm like, look, you got to go and do the thing. And that in and of itself is a big commitment that you're asking someone to make.
And you need to be cultivating more than one champion.
Yes.
Because there's only one Commissioner Regalado, but, we can't count on her. I mean, we will count on her forever, but you can't count on a singular person to drive the agenda. You have to we're constantly cultivating at CARD new partnerships, new champions, and it's really important that the network get wider as much as possible. The other thing I will say from a policy, I guess you asked about, or structure perspective, I'm invested in the developmental disability world. That's my passion, that's my expertise. I think there's great value in a disability advisory board, of course, broadly. But I really do love the special needs focus of how they're working in Miami Lakes, because I do think sometimes the needs of that community in a broader disability, but this has been my experience, and come at me if you have to later. But I just find like sometimes our needs are a little bit underrepresented in some of those broader disability boards. So I think even if there's a subcommittee that's focused on the developmentally disabled, the special needs community, I think that can be very helpful at focusing some of those efforts a little bit more.
The needs are very different, right? The special needs, sorry, Jeff. The special needs community is very different than the broader disability community. And the numbers are greater usually in the developmental disabilities kind of space. And so I think the opposite is also true, that the broader disability space may get kind of lost with all of the special needs programming. So I do think having like a special subcommittee or a special group focused on those issues as part of a broader group where we make sure everybody's needs are met, but the needs of people with developmental disabilities are very different and require some special thought and special folks dedicated to thinking about that space as well.
Dr. Brasco?
Yeah, sorry.
No, it's okay. Just and this is taking a 30,000-foot view and thinking about systems and how you really drive change. And what we've heard is fantastic. And I think it's what money drives things so much. And there's some really amazing things happening. Medicaid in our county is about $1 billion that goes for child health. And there are states that have turned Medicaid from a reimbursement for doing something into an investment into children and the community. So in Ohio, for example, they do something called a withhold. And what that means is you say to the big insurance companies, we're going to withhold $6 billion from you. And we're only going to give it back to you if you meet certain quality metrics. And what's really fascinating about what they're trying to do in Ohio is those quality metrics aren't just for that one company, that our patients did well. It's for the entire community. And you know what their quality metrics are like? They're talking about things like kindergarten readiness, attending school, graduating high school, things that really matter at society level. So imagine now when you have this huge behemoth, all this money that's aimed not just at can we turn things over and deny services and keep the profits, it's can we develop community systems that increase for the entire population improved outcomes. Now the tricky part in this is we have to make sure that kids with disabilities don't get left behind when you're looking at a population level. So it's a lot of the work we need to keep doing. But in addition to the sort of hard work we do locally, there are also systems level changes that point the arrows in a direction that all the training we do suddenly makes sense. And all the investment in children suddenly makes sense because someone's going to make some money from it. And that's always important in these systems.
Well, I agree with you, and all the changes that we need at the state level is like another conversation. There's like a whole other.
No comment.
No comment. I know. Other than CARD, they should fund more. They should give CARD more money. We'll start there. But I agree with you. But one of the things that I'm working on for October is our economic power as a community. We have economic power. And maybe I come at this because I'm a Cuban, and like we're like all like support the enclave, right? So it's like a cultural thing for us. But when I talk to parents, I'm like, well, the purchases that you make, the places that you go, do they employ our kids? Have you asked the question? Because I asked the question, and I'm not doing it to shame anyone. I want to know. Because I want to support the people who support the people that I love, right? And I'm not being discriminatory. I'm just being honest. People need to see that we have purchasing power and that we're willing to walk away from something because they're not supportive. Because a picture and a puzzle piece ain't going to cut it for me. I want to know, what exactly are you doing to support this community? And the same is true for government and for elected officials. I'm not interested in your Instagram reel. I want to know what you did. What did you fund? What did you fix? What did you support? Because you give money to all these things. I want to know, what you did. So I think the accountability piece is a very important piece. And we could really start showing our economic power. And that's something, Michael was talking earlier about the hospitals. It breaks my heart. I've sat in so many rooms talking to so many hospitals. And they're all like, oh, that sounds a great idea. Oh, that sounds a great idea. And then like you follow up and you follow up and you follow up and they're just not training, they're just not training. And then you ask yourself, and then people ask me, oh, why do you go to Jackson? Is it because you're a county commissioner? And I'm like, no, I go to Jackson because they're trained, right? And CARD trained them. That's why I go to the Jackson Urgent Care, you know? So we also need to say the thing, right? And unfortunately, some people are still a little shy about that, right? We're still like in a space where we're like, oh, I don't want to be that person. But if you want to effectuate change, we kind of have to be those people. And I think that and the same thing, and I'll I say this, I don't agree with the guardianship process. It was not made for our children. It was made for elderly people who are losing their capacity. So I have a lot of issues with that entire system and what it requires parents to do, but sometimes it is necessary. But I also feel very strongly about our children voting. Our children should vote. They should vote, because what happens in these rooms impacts them, and they should vote. And my children vote, and I take them to vote. So, and I explain to them like how these humans on the ballot, one by one, what have they done for inclusion? So I think that that's something that we all have to choose to do.
I wanted to talk a little bit about resources and what advisory boards really need, and not because our mayor is here, we're not going to ask you anything, but what do we need, staff support, data, budget, training? What is that really makes a board, a disability board, more effective, more efficient?
I want to jump in first.
Well, I mean, you have to have the right people, right? I mean, I think you have to have the people who have the vision and have the time to commit to making change, right? And then I think you have to have the voices of the the ears of the elected officials to implement and execute a plan. I mean, I think every board should have a strategic plan. I think every board should set annual goals for itself. I think there should be some metrics to evaluate whether things are working. There has to be some kind of open communication system with the public so you can get, real-time feedback about what people need and let that shape your way forward. I live in a world that we never have enough resources. So we've learned to create something out of nothing. Not that we're getting nothing. We're obviously getting something, but we don't get anywhere near where we need. And we've been around now 33 years. So we're not the new shiny object that gets the attention in Tallahassee every year. I always tell people, invest in the thing that you've built and that works. Why are we throwing money now at new creations? Because somebody thought something new was needed. So I don't think we need a lot of resources. What's that? I don't think we need a lot of resources to have an impact in even a community like Key Biscayne, just because we're here. I think you can have an impact by just leveraging your partnerships, strategically and creatively. And I think there'd be, so.
You do need the municipality and the elected officials to prioritize it, though. Even if it's not at a monetary level, but to prioritize those partnerships, to prioritize those projects, to commit to advertising them, to commit to, putting that out there as this is what we're doing as a community for our community. Because otherwise, it's not going to be successful.
Well, we've talked about this already, but there's a lot of stuff that happens that nobody ever knows about, right? So there has to be some kind of marketing plan as well to make sure the residents know what you've built, what you've created. I know there was, for a while here, you were offering, I know Elton's here somewhere.
Yep,
I know
he's back there.
Elton's doing some work here, but even before Elton, there was some programming going on, and I think it was probably underutilized because I think because I had clients who were telling me that they weren't aware of some of the things that I was aware of, and this is not unique to Key Biscayne. This is happening in every municipality that we work with. There are things that we do that our families never know about because we just we're not doing a good enough job communicating in terms of getting the message out. So any kind of municipality-based marketing support, I think, would be really, really helpful, and that would be where I'd put most of my investment, to be honest with you, because I think that's where the real weakness is.
I would add to that some caregivers have like wicked skills, right? So I think you can also like recruit people for specific purposes. And a goal setting is like at the top of the list, right? So you got to figure out like what your goals are. If you don't know where you're going, you're going to get there, right? I mean, not to quote Alice in Wonderland, but, so I think the goal setting is a priority, but then also the people on the board, what are their special gifts? Like what is their strength and how do you lean into that strength? So to Michael's point, events and access and resources is important. So you need a human who is going to be, and you just pick a human who's already on social media, right? And you're just like, hey, listen, open a new account. The algorithm is only going to be about this. Rather than cooking, you're going to look at autism stuff, and you're going to tell us like if different things are happening so that we can push it out, and we can ask the municipalities to push it out because they already have the social media infrastructure and the email infrastructure. And then you're going to take another human who, like me, likes to use AI and Claude and say, hey, human, like these are all the events. Can you put this into a newsletter, right? And can you give it to us so we can give it to our electeds so that they can push it out? And right there, you've done an amazing amount of work because now you're telling people what's out there. You're organizing it in different ways. Not everybody is on social. Some people are on emails. Then you can grab, I have an Alejandro. I won't give him to you. But you can grab an amazing human that'll do webinars, right? And you could say, I told Alejandro, I want to do webinar Wednesdays. Here we are. So you could do webinars, and you could pick a human that's like good at that, and you can find somebody in the municipality that wants to do that too, and you could do that, and that's a form of outreach that doesn't really like cost money. It costs time and talent, right? But those are all things that you can do. And then you grab an attorney, and you're like, hey, here's a toolkit. Go to town, right? Put something together, this is what different people have done. And then you can take someone that's an extrovert and tell them to call other cities, right? And find partners, Human beings, it's just like our kids, people. Everybody needs a visual schedule. Everybody needs to be told, hey, these are the 5 things, right? Like, this is what we need you to do. You need to do 1, 2, 3, 4. And then you have accountability on those things. And you'd be surprised how impactful you are if you just get a little bit organized and you start asking people to do things. I mean, I've built an entire career asking people to do things that everybody was like, you want what now, when? And you'd be surprised. People will rise to the occasion. People will rise to the occasion, and they'll do it, and they'll become believers, and they'll sign up, and they'll push it out too. But you have to kind of have I would say, from the board perspective, sit down and have a workshop where everybody's very honest with, like, what's my strength? What do I feel comfortable doing? What are the assets that I'm bringing to this table? And by the way, they can outsource those assets to other people. Like, they can outsource that work to other people, right? But like, it's on them to follow up is what I'm saying. And then kind of figure out, okay, this is what we're doing. This is our plan. And this is how we're going to move this forward, and here are our goals, and every 6 months we're going to check in, and we're going to do 1, 2, 3, and these are our metrics.
I think that one other thing I'll say, which may be somewhat unpopular, is don't get on the board because you want something specific for your kid.
Oh, you're right.
Do you know what I mean? Like, because that could be really
that doesn't
not
work.
a good thing. Like, you've really got to make a commitment to having something happen that may not even benefit your child right away. Like, Commissioner Regalado has given us, we call her our muse because she inspires so much good from our organization. But a lot of what we've done, I mean, some of it has benefited her kids in some way, but it's not about her. Her kids inspired her, but the mission is much broader than that. So I think that's important that when you go into that kind of service, and most people who serve understand that, but I've experienced some other indications that some people don't quite understand that. So I would say go in selflessly because the community needs selfless people to make a difference.
And I promised I did not send the questions before because all the answers are leading into my next question and the last one, which is related to measuring success. How we always talking internally, how can we really measure our impact? What are we doing? We want to know what we're just saying in terms of having that plan and how do we measure that success?
I think, you have to set several metrics. I don't think that, first of all, it's been my experience that people will come up to you in the grocery store, and in different places and tell you a story. So anecdotally, you will find out if you were effective because people will come up to you because unfortunately or fortunately, whatever, in our community, people don't feel comfortable yet coming up like to the mic and speaking. It's still, like I said at the beginning, a very like verbal type of one-on-one type of thing. So people will come up to you and say, hey, I heard about this or have a question about that. So you'll start seeing that you're having an impact, right? Like on the day-to-day with people. But then you have to set some goals, and you have to, participation is a big goal. You know, you got to get people to participate. And to Michael's point, maybe what you're doing is not, maybe you're not some, you know, maybe they're not buying because they don't like what you're selling, right? Maybe you got to tweak it and do something else. You know, maybe something that you think is a great idea isn't, you know, that's not what people want. And maybe you have to do a little bit more outreach and not take it personally. You know, I always tell my team, you know, we make mistakes all the time because that's just the nature of the work that we do. We all make mistakes. There's nothing that is perfect. Just make different mistakes. That's all. That's all I ask anybody to do. I'm just like, just don't make the same mistake twice. Like, just make different mistakes, right? And you know, speaking of my kids, we have like a family motto that we joke about all the time, and is, we didn't come this far only to come this far, right? So I'm constantly like with the next thing, right? And you also have to give yourself a little bit of grace, right? Like, there will be moments where you're like, why do I do this? But that's fine. You just kind of, you know, retool and like push on to like the next thing. So, you know, I think you do have to have metrics. Participation is one of those metrics. Feedback from your electeds, because they're going to get feedback, is another metric that you need to add on there. And then are you meeting your goals? So I think those are the three things on how you measure success of something like this, you know, and then, you know, after you do it for a while, someone will come up and say, I want to do what you're doing where I live. And that's where you know you made it. I mean, and the human equivalent of that, and this happens to me, and I tell people this is like the measure of success, is when someone comes up to you and says, I want you to have coffee with my daughter. Like, yes, like now you are a successful human, right? Now someone wants you to mentor their child, you know, like, ding, I made it. So when that's like when you've done it for a few years, that's what'll happen. People will be like, you did this, that's cool. How do I do that? But I think those are the three easy ones that you can start with, and take it from there. But, you know, again, you will fail. There will be things that won't work. And that's fine. That's perfectly fine.
That's hard. When things don't work. You don't take it. I take everything personally because it's just like you put so much into it, and if it doesn't work and people don't show up or don't appreciate it or don't like it, or, you know, it's just, it lives in my brain for forever. So I will say, I want to just congratulate the folks from Key Biscayne, because this is the first of its kind gathering, and that you've already ticked off one very, very big
Love
goal.
it.
Very
Love
big goal.
it. Love it.
Dr. Brosco? Okay. So I want to thank everybody in the panel. This, I think, was amazing.
Are we ending?
No, we're
We
not
are
ending.
for
Stay
the-
there. Don't move.
Not everything, right? We're moving into the
Second half.
It's actually, I just want to say one thing about measurements.
Please go ahead.
And I apologize. My kids say every time I start to talk, it's a mini lecture. So I apologize.
We like it.
Just, I want to come back to one more big systems idea, and that is, again, the way our system is set up. I said before that, you know, I kind of implied we get what we pay for with our, in early steps, for example. We don't get what we pay for. We put so much money into the education system, the healthcare system. We do not get what we pay for.
That's true.
And I'm going to tell you, it's because the system is completely broken. There are attempts to try to fix it. I just want to tell you quickly what we're doing with CARD, Mailman Center, University of Miami, with CARD to try to fix it. Right now, the healthcare system is set up, you guys know this, fee-for-service, right? So I'm a pediatrician. In addition to seeing kids with autism and ADHD, I see kids with asthma. And if I see a child with asthma, I get paid, a 99214, whatever it is. If I do a lousy job, they come back the next day, I get paid again. If I do a lousy job, they go to the emergency room, they get paid. If they don't do well, they go to the hospital, they get paid, all the way to the ICU. So it's not that any of us do a bad job on purpose, but really, there's no incentive other than you want to try to do a good job. The healthcare system is shifting, especially in the adult world, to flip it the other way around. It says, in fact, we're just going to give you a lump sum of dollars, and you're responsible for everything, and we're going to measure the quality, right? This is the outcomes thing. We're going to see, is that child doing better? Are they in school? Do they feel like they belong? Are the parents able to work? Are the parents spending all their time on care coordination, or do they have time to be together as a family? Now imagine what happens. It's different. So in the asthma example, I would want to spend a lot of time that first day. Do you know how to use your inhaler? Does the school nurse know what she needs to do or he needs to do? What are all the things we can do? Can we look at the air conditioning? Are there mold? What can we do to promote health? And in the autism world in particular, we spend way more dollars than anything else. The average child in healthcare, it's about $500 a year. Kids don't cost very much. Kids with ADHD, anxiety, $4,000, $5,000 per year. Autism is $21,000 per year per child. That's what we in the state of Florida are spending. Are we getting value for that money? No. So part of what Michael and Jen and I are doing at University of Miami is trying to think about, suppose we reversed it and we said, we are going to actually say that we're responsible for outcomes and not just the more we do, the more we get paid. Of those of you who have a child who's affected with autism, how many of you feel like there's at least one person who feels responsible for outcomes and makes sure your child gets what they need to get? Or is it you that has to do that?
Not too, yeah.
It's usually you, right? But suppose it worked out such that there was at least one person, right, and this would be our program that we're thinking about, that said, actually, we're responsible for outcomes. We need to help work with you to figure that out. So all the care coordination doesn't fall on you, it falls on the system. We're incentivized to do it right. So I think there are ways we can think big about changing systems that make the work that you guys are doing in disability boards that much more effective.
Thank you. Thank you, everyone. I think, you know, in the bigger role of our boards and what we do, definitely we are, you know, trying to get this expert perspective that you can bring to us, and this is amazing. So thank you so much. Appreciate it. We're going to transition into second panel with
Second
board
panel.
members. Oh, for sure.
Yes.
No questions.
Questions and answers.
Is this on? Andrea. I don't think I might need it, but you can try. Okay. Hello, my name is Andrea. I actually just have a comment. As a mother of a child that is blind with cerebral palsy and eats continuously by GJ tube, 16 hours to 24 hours a day, I have said so many times, and forgive me for saying this, but I have said maybe I wish my son had cancer or autism, because then maybe I'll have one doctor that will help me manage my child's 18 to 20 specialists and 13 therapies a week. So yeah, maybe that can.
Andrea, I have a little piece of information for you.
Please.
I don't know if you know this, but CARD is, I don't know if you know about CARD. CARD is
don't.
the Center for Autism and Related Disabilities. And included in those related disabilities are children with hearing or vision loss and another disabling condition. So you've
now
just
I'll
described
need
a
to pester you
child.
for the rest of my life.
You could, for the rest of mine, probably. I think I'll be gone first. But let's connect after, because you could register with CARD and get a case manager assigned to your case and to help you navigate some of those decisions. Yeah, and a lot of people don't know about the RD and CARD.
And just to add to that, what you're describing, we call a child with medical complexity, when there's so many different things going on, so there's not really one person in charge. And federal CMS, the Center for Medicaid and Medicare, is announcing a new program called Aspire that's going to incentivize some states, and maybe Florida will be one, to try to address exactly what you're just talking about. Like, how do we make sure that the value-based care I just described works for children like yours? So there's some federal efforts in that way.
All right, so, oh, go ahead.
This is our amazing commissioner from South Miami, Steve Gaye.
Good evening, Mike. You guys hear me?
Yes.
Good evening. So I think one of the things that I've struggled with as an elected official is really to understand, how do we get more people involved in boards? I struggle with that with our Unique Abilities Board. I struggle with design review boards. Like, in your opinion, can you give me some feedback, how to get more people involved? From a marketing perspective, I like to get the word out there. I just don't know if it's getting to them. So what do you guys suggest that we do as a community to get more people involved in boards?
Yeah.
We're staying in South Miami for now.
I think, Steve, for parents with this, I mean, I think it's different for everyone, but I think the mistake that boards make, and when I talk to people, when I put them on boards as a county official, is I approach it like a job, and I just tell them what the expectations are. Because there's a lot of people who are like, oh, I don't have time for a board, or I don't have time, or am I qualified? Like, there's all these different things. So I try, when I find people that I think would be good for a board, I talk to them about it, and I say, look, this is how often it meets, these are the expectations, and I kind of, pitch it. And then if they reject me completely, then I put it on them to try to find me another human, and I'm like, hey, listen, you really broke my heart. And now I need you, I'm a Catholic. I open a shame on the daily. So I'm like, now I need you to help me find someone else, right? You got any ideas? And you'd be surprised. Like sometimes people will be like, hey, there's this person or that person, right? Maybe, and then try to make it easy for your board, right? So in person is really hard for our population. One of the reasons that I'm such a fan of virtual meetings and webinars is because I have a kid, that if she's having a bad day, I'm not leaving. That's just the nature of our relationship. But I could do a Zoom, and she may or may not jump in and say something, right? And you may or may not hear her in the background, but I can be there virtually sometimes. So I think with these boards, you need to have a little bit of flexibility, and maybe you say, hey, we're doing an in-person this, but maybe the workshop is virtual, right? So that you give them that. Because if they think, oh my God, I have to be somewhere at this time in person every time, I don't know if I can do that, and so I think that's kind of the bigger issue with disability boards is the in-person and the set time. And then also poll people about what's a good time, because you may be able to get the humans there at a particular time, which may or may not work for the public, but then you can record it, and then you can push it out, and then you could do public comment by email. So we have all this technology, right, that we can utilize, because there is a world in which this parent could probably do it during the day, but definitely not at 6 o'clock, or at 7. So those are the things, try to play with that and try to figure out, what works for people. So I think flexibility is key. I also try for a lot of our boards, like I sit on the board of SFRTA, which is Tri-Rail, and they're like in Pompano, and a lot of our members don't make it, but we have a physical quorum, and then the other people get to be virtually. And then if you do virtual too many times, we're like, hey, you ever come in person? So then, and then people like swap out, right? So then one person will like commit, and then 2 months like virtual, and then they'll come back. And that way everybody gets to participate, everybody gets to vote, but not everybody has to physically be there.
I also think if the boards that have a more defined mission are more attractive to our families are very focused on the things that matter to them. So this is why I was talking earlier about a special needs component to a broader disability advisory, because I just think our parents, they're interested in what they're interested in. So a narrowly defined mission, and I think having clearly articulated goals that resonate with them, and if those can be shared with them, and we have an email that goes out to I don't know how many tens of thousands of people, and we could also sort by zip code and send stuff out to people in South Miami if you wanted to recruit from our constituency at some point. So there are, again, using your partners to get the word out and not just relying on your own media channels, because our folks may not be paying attention to all of the things outside. At least in the autism world, I think all our families are paying attention to autism. That's the thing, that's their special interest. I see someone behind you, Elise.
Is this working? Yeah. I think I work in the city of Miami Beach, and again, each community is different, but in Miami Beach, board members get free parking, which citywide, which Miami Beach means something.
Didn't know that.
Okay.
Michael's like, I'm joining a board.
I'll go back.
Of course. Now, of course, they are appointed by commissioners, and commissioners do go through the requisites, like the requirements. So you already do that. I think that attracts people. In Miami Beach, at a minimum, it makes it different.
And I was going to add to that, that you pay when you can. So for example, for our federal deaf and hard of hearing grants, 20% of the budget of any organization has to go directly to consumers who are participating. So you can make that part of your policy and part of your grant making, that you have to, some of the money has to go to the families that are participating in the youth as a policy.
Good evening, everybody. My name is Ethan Rivero.
We can hear you. Go.
Good evening, Ethan. Good evening, everybody. My name is Ethan Rivero. I am with the Miami Lakes Special Needs Advisory Board. One thing I would advise individuals who are looking to join boards is that if you are rejected the first time, don't give up. Actually, ask if you can volunteer, as was the case with myself when I joined Miami Lakes. The first time, I was not selected. However, I was a volunteer for a majority of their events, and then I was admitted the following year. And I suppose my question is that I am actually trying to, one of the issues I want to tackle in my community is employment and independent living skills. So I'm trying to see exactly what are the best approaches for that. As an individual with ASD myself, I want to see how, since I've been blessed with two loving parents who have supported me throughout my journey, I actually wanted to see how other individuals can have a similar outcome like myself. So I'm looking for ways to begin. Yes, you certainly may.
So the Village of Key Biscayne is partnering with the Des Moines Foundation. I know you guys are too, but we are too, because we are an ideal place for that program, and we have people who want it, and it's amazing. So I suggest you guys do that too. I'm sure they would be open to it. Yeah, okay, never mind. There you go.
So, yeah.
The only problem with the Des Moines Foundation, they're an awesome organization, is there's a long wait. And it's not like, oh, we have an applicant, we've got a job for them. I think the last time we checked, the wait list is like a year out.
Yeah.
6 months to a year out, so.
I'm glad you brought the Des Moines Foundation up, because and anyone who's, I don't know if people can hear us or not, because there've been some just chatter there that they can't, but the only rate limiting factor in getting more people employed is having more employment partners. That's what the Des Moines Foundation needs. They need more businesses to step up and create opportunities and partner with them. We have the candidates to work. It's just a matter of finding the employers who are willing to create some space for our neurodiverse people.
Yeah, and within your municipality, you can lobby, you can go to businesses and see who's willing to commit to receiving some training, not just training on how their business can be welcoming to people with disabilities, but also commitment to, will you employ people with disabilities, and how can we get you the training to make that successful?
So I think there's a lot of things you could do. You know, and Michael talks about this a lot, and I've talked to the county about it. It's on our to-do list for October. So October is Disability Employment Month, which is when we kind of tackle that. And one of the things is, every time an item comes before me, like sometimes I just amend it, right? So we had an item about internships at the county, and I amended it to include neurodiverse individuals. And then we had a whole conversation with them about that onboarding process and the interviewing. And one of the things that we've been educating our partners about, and Michael talks about this a lot, is how they interview. Because if the job posting says like needs to communicate, right, my kid's not going to apply. But also if you allow someone to do the skill, right, to do the work as opposed to talk to you about the work. The other thing that we've gotten folks at the county to start understanding is to give people the questions ahead of time. Because if you give them the questions ahead of time, they can think about their answers and prepare their answers, and they're not so nervous. It's like the adulting version of a social story. And that really changes the conversation. And then, are you willing to incubate? Understanding that incubation is different than employment, in the neurotypical sense. So I've been reaching out to a lot of the folks that do this work to talk about incubation. Our library system is a place where we do a lot of incubation, where people volunteer, and now that everybody's trained, it's like a safe space. I think it always was kind of like a great space, but now it's like everybody gets it. So wherever you have training, you have the ability to volunteer and start understanding the concept of work and dealing with responsibilities without the fear of being fired. So to our parents, I always say, and I'm glad that you started with volunteering, because that's such a better way to kind of enter the space. And now we're looking at who is interested in training. So for example, No Limits Cafe is interested in training. They're such amazing, partners, but not everyone is interested in training, right? And from my perspective, I love that there are organizations that are doing great work and they're getting someone a job, but I'm really interested in a career path. And in like that, someone scaling up from that job to another job, right? So how do we figure that out? So I think you definitely have to change the hiring. You have to train people in there, or go to a place where everyone's been trained, right? So you kind of circumvent your problem. And then when we did KLA, which I mentioned earlier, it was challenging. So now we're going to train Career Source, and they're going to have like a manager there, and then see how that works. The other thing that we have found with KLA that I think is very interesting is they do better if you pair them. So if you, and my son is a clear example of that, and some of his peers, when they went into the work environment with another autistic person, they had a buddy, so they didn't feel so alone, and they did so much better. And I think that's a model that we should consider, because they have each other, so they don't feel like they're the only person that's different. So we're trying to figure that out. I mean, it's a work in progress, but to Michael's point, we're constantly trying to attract partners. Best Buddies is doing some of this work. I mean, there's a lot of people that are doing, this work, but everybody's doing it in a different way, and that's fine. And I think that we have to applaud everyone who's doing it, right?
Sure.
There's all these different levels of scalability, but I think we have to say, like, everybody is doing it, fantastic, like, we need to do more. But then on the caregiver side, or, as the actual human, CARD has some amazing program, and the Mailman Center has some amazing program on how to be a self-advocate, because that's like another part of this thing, right? So we don't talk about that a lot, but that's like a thing. And because, you also have to be able to navigate that, and that's tough. And I think we also at some point need to create some support for when employment doesn't work, right? So that then we can try again, because what I have found is when they have a negative employment situation, then it's very difficult to get them to try something else. And by the way, everybody's had a bad job. I worked at Blockbuster, I had a horrible boss. You don't know what Blockbuster is, but he was a jerk, and as a grown-up, I can tell you, having bad bosses is part of becoming a good boss yourself. Because if you didn't have a bad experience, you don't know what not to do. So I think we also, as organizations and as parents, need to kind of peel away this idea that it's going to be this like perfect experience. It's not. It's going to be painful. By the way, like every other experience to this point. But it's a learning experience. And it's just, we have a tendency to idealize it a little bit, because it is tied to the concept of adulthood. But we also have to be honest that, no one can say that they've had a perfect job like their entire life and that they always worked with wonderful people. Like everybody has worked with, challenging humans, and it's always been like a hit or miss. So I think as we create infrastructure, we have to figure that out. And one of the things that I've seen recently that is very helpful is groups of autistic adults and neurodivergent adults who are employed, who meet and talk to each other about their employment experiences. That has ended up like being amazing, and it's kind of happening like on their own. But it's a very interesting thing because they get to, to Michael's point, everybody wants to be seen, heard, and understood. They get to share their employment, experiences with similarly situated individuals, and that changes because they don't want to hear from me. Like the last thing they want to hear is another neurotypical person giving an opinion. So, it hits different, right? When it happens in that way. And I think that's one of the things, that we're kind of grappling with. And what happens when you get an employment gap? How do you get them out of that employment gap? How do you retool them? How do they go back, and learn something else? And by the way, this is happening to neurotypical people. There's literally neurotypical people out there who don't have the skills to be employed and are going back and are getting retooling. So this is not like a new thing. And the last thing I'll say, one of the things that we're looking at right now is using artificial intelligence as a support. And that is being tested out, and it's going relatively well. I don't think it's a solution to everything, but it might be one of the tools that we use kind of moving forward.
A couple of final thoughts, I guess, from I think we're wrapping up, right? The first panel. CARD, just for those who don't know, CARD offers a couple of programs that are relevant to the employment conversation. One is called Job Seekers, which is a pre-employment training program. It's a manualized, intensive, week-long training about interviewing skills, how to dress for a job, how to interact socially on the job site. We teach, a whole curriculum, and we do that every summer. And then we have an ongoing job club where people who are job seeking can meet each month with other job seekers to share their experiences with interviews and the whole process of trying to get a job. The other thing I'll say, I think I've lived in the disability space for now 45 years. I think it's 45 years. The disability community alone is not going to solve the employment problem. We really need the broader society to create scalable solutions, right? Larger multinational companies, and there's some action in this arena, but it's not enough. And the other thing is we need, I teach a class every spring called Genetic and Developmental Disorders, and in the first lecture, I always tell the students, 10 years from now, when you're doctors and lawyers and CEOs, I want you to remember this class, and I want you to create job opportunities in your businesses, because we have to be ambassadors for change. Each of us has a neighbor, each of us has a cousin, each of us has a friend who is not in this world that we're living in, who could create opportunities for our loved ones. And I think the other thing I just want to say is I want to congratulate you, Ethan, for persisting and being a self-advocate and not giving up. And we're glad you're here.
Panel number one, you are still a panel number one. Do not go anywhere. We are going to stand up, and we would like to add to this amazing panel that we already have. I'd like to ask a representative from each of the different municipalities that are here today to come up. Doral, for example. Do we have someone here from Doral? Yes, you do. Are you Stephanie Guerrero? Please come on up. So Stephanie will be representing the Disability Advisory Board in the Doral. You can have a seat right here. Elise, why don't you take Mayor Joe Rasco's seat?
Mayor Binhack.
Elise is our chair, Key Biscayne Disability Advisory Board. Coral Gables, who would like to come up? I know there are several of you. You have. Well, you can share a seat if you'd like.
I'm not bad.
So come on up, and would you like to just sit over there? Okay. Coral Gables is here. Miami Lakes.
I see
Who
Miami
would like
Lakes
to
in the
speak from
house.
Miami Lakes?
Come on, Jesse.
The giggles, okay. I get the feeling. South Miami.
Steve.
Who's here from South Miami that would like to come represent their board? South Miami. Dr. Sandy Calle, are you here?
Yes.
Okay, thank you. Miami Beach.
Come on down.
Like to come up, please? I will move out of the way. And Miami-Dade Commissioner? Anyone from Miami-Dade Commissioner?
She's Miami-Dade
I am the Miami-Dade Commissioner. I'm like, is there another one here?
Isn't there a person representing a
them.
disability?
You mean for the Miami-Dade Board? Yes. Okay, that's different. Yeah, the Miami-Dade Disability Board. There's a county board.
Anybody else? Have I missed anything? I don't think so. Okay. Wonderful. All right, so Alessandro, I guess, all right, then I guess I'll stay here. I was going to move. All right, so what we would like to do is we'd like to, I mean, this is the meat of it, right? We want to learn from each other and find out what you're doing in your community. We want to copycat whatever you're doing and find out what struggles you've had and what successes you've had and how we can learn from each other. So we're really excited about this moment in our planning. Why don't we start with you? Please introduce yourself. Tell us which municipality you're representing, the size of people in your group, in your board, and how long the board has existed.
Hi, I'm Stephanie Guerrero. I'm representing the Doral Special Needs Advisory Committee. It's 4 of us. I want to say we've been around 3 or 4 years. I'm not entirely sure. I have been attending meetings for 2 years, and then this year is the first year that I'm a member of the board.
Thank you. Would you like to tell
Hi.
us?
My name is Valeria Mejia. I am the liaison to Miami Beach Disability Access Committee. I see one of our members online. He didn't have a sound earlier, and the ones that came in person had to leave. But I can share about Miami Beach. So I've been the liaison. I'm the ADA coordinator, later manager. So I oversee everything accessibility in the city, and I've been with this board for the liaison to the board for 12 years, almost 12 years. So I've seen a lot of members come and go and things that they have accomplished.
So the board has existed for 12 years?
I believe a little longer. That's the amount of time I've been with the city, and I think the board exists a little longer than that. David is online. David was part of the creation of the board. David, you know how long the board has existed?
The inception was 1998, I believe.
Look at that.
Nice.
Thank you. So that long.
Wonderful. Thank you for representing them. And we apologize to all of those who are zooming in and unable to hear. You can hear now. Sorry for the early ones that couldn't hear. We know that was a problem, and fortunately it was fixed. Go on, please.
Hi, my name is Sandy Guy. I'm the chair of the Unique Ability Boards for South Miami. We're new. We just started August this fall. So, yeah, so we're excited. I'm a pediatrician. I've been practicing within Miami Beach Community Health Center, so neighbor, for over 15 years. My specialty is community health, and Dr. Roscoe was one of my mentors at University of Miami, so it was nice to see him. And so as Commissioner Gaia mentioned, we've been struggling with members. I think we have 3 full-time members now, 2 vacancies that we're looking to fill. So I think that's been our biggest hurdle. Within our members, I think we have strong leadership, beginning with my background as a pediatrician. We have another member that is a speech therapist that deals with autistic patients and neurodevelopmental disabilities. And then we have Victor, the autism dad, as part of our 3rd member. So I think we have a strong committee with a lot of ideas, but hurdles as far as meeting quorum to make sure that we can fulfill our duties within our community.
Congratulations.
Thank you.
Elise.
So I'm Elise Binhack, and can you?
No, you're off.
Oh, that's why he turned it off.
It's counterintuitive because it's red when it's on. It's weird.
Exactly. Good to know. And I'm on the Key Biscayne Disability Advisory Board, and we are relatively new, so that's why we did this, because we want to learn and we want to be more effective, and we want to really move the needle on Key Biscayne. So we have 7 members, and we're very excited.
District 7 is representing.
Hi, I'm Eddie Martinez from Coral Gables, and I'm on the Disability Advisory Board. I've only been there about 2 years, I believe, but the board has been around for about 25 years or more. Some really long time. And Monty can share a lot later on, but I'm happy to be here because I was sharing that I'm involved in more of an employment basis because I'm a dad. I'm not really in the space, but I'm trying to do a lot of things with employment and stuff to move things forward for my son and other kids too.
Hello, my name is Jessie Orellana, and I am a member of the Special Needs Advisory Board in the town of Miami Lakes. I know the board started sometime in 2011, then it went dormant, and it started back up in 2018, which that's when I became a member, so it'll be 8 years, I believe in September, that I've been a part, and it's been a blessing. And Dr. Alessandri, he said something, and I agree. I think a lot of times people get on the board for personal gain, whether it's their own child, but I've also seen it business because, you know, they're live streamed and they want to put it out there. So we've had members that have come in and they've gone to 1 or 2 meetings and they're like, I didn't get anything out of it. And they'll just, so at the beginning we did have that issue. So you can feel better. We have 7 members and they're all, I mean, on board 100%. They go not only to the meetings, because we've had that too. They go to the meetings and then we have an event and there's 2 board members and everything is falling on those 2. But we have a strong board. It's taken time, it has, but I think we're in a good place.
Well, thank you. Here's another question. I'm not going to go in any order. I'd like to, whoever wants to speak first, please do so. Please describe your board's single greatest accomplishment so far. And you can take a few seconds if you want to think about it. And of course, we're going to ask you what challenges came with that and what successes you had. But think about what your most proud, the greatest accomplishment that you have achieved. And if you need some time, Elise will go first. Key Biscayne, go ahead.
Easy peasy. We lobbied the administration to create a new position in the village administration. It's called Resident Experience Coordinator. And this person, a core part of their job is special needs coordination. But, you know, and we are going to support them and fully onboard them. But they also do other components of resident experience, customer service stuff. But we are super excited. This will give the residents with disabilities in our community a voice and a go-to person. And we are super excited about that. So. Take the microphone.
Can you hear me? No. Step up, Commissioner.
I'd like to add a couple of notes on that. Our group worked very hard because the council and people in general didn't understand the need. So the group experienced some brick walls, but kept going, and were never detoured. And I think at the end, what we all learned was we had to educate everybody. And as soon as the council understood the need, they were very happy to accommodate the financial part of it to the extent that they could, which was part of one job, one position. And they're trying to help us now, if anyone knows someone, to fill the job. And my point is, it wasn't easy. The council didn't just say, here, go ahead and do it. It took months and months and a lot of lobbying and educating. And I'm really proud of our board for having accomplished. It's a huge accomplishment.
And I just want to say one last thing. We have flyers that describe the job position. So if anyone here knows anyone who wants to do this job, please take one and give it to them, please. We want to find an amazing person. Thank you. That's it.
So I don't have one big accomplishment, but I will say that our board, through the years, I feel we've done a lot for being just 7 board members. And actually, the town of Miami Lakes isn't very big. If you look us up, we're 6 square miles. So it's not a lot of us, but I feel we've done a lot. One of those, or a few of those things that we've been able to bring, when we first started, we did a survey through FIU, a very expensive one, by the way, but we did that to see what the town needed, because we didn't want to just come in and say, oh, this is what each board member feels we need. And it was very extensive. And one of the main things was social programs. And one of the things we've been able to bring into Miami Lakes is a contactless dojo program. We have it twice a week, and the only contact that is made is the sensei and the karate person, right, or the member. And I think that is huge, and we've gotten so much amazing feedback on that. We've also been able to have dance classes with Arts for Autism. Audrey Amadeo, I don't know if you've heard her before, but we have those classes. They happen on Saturdays. And this is something that the board, we are the ones that cover those costs. And our monies come from the Mayor's Gala. So we also have the backing of the council, which has been huge. One of the biggest things for me this year, I don't know if you've heard of the Family Cafe.
Yes.
I know there's a lot of people that have it. Well, this year, 6 of our 7 members will be going to the Family Cafe, not just to see what we can do here in our community, but what's being done all around Florida so we can bring it back. So that's one of the other things that we're also doing. And something super exciting, we had a parent, she's also an RBT, she came to one of our meetings and she spoke about a communication board that she saw at a park. Well, we just installed 2 of those communication boards in 2 of our parks, and we're ordering 2 more for our other 2 sports parks. So that's some of the things that we've been able to accomplish. And I'm sure there's more, but those are...
You guys also had a great art show recently. That was amazing. And I think, Ethan, you were there, right? Yes. And then game night, I think, is coming up, right?
Yes.
Yeah.
Well, we have a game night, yes.
Like it's just, I just want to, because I want to comment on those 2 things, because sometimes we think we have to do something on a large scale, and it's just these one-off events where you can bring the community together. It's really quite lovely, and I was happy to be at the last art show. So.
Yeah, and I just wanted to mention really quickly, at Town Hall, we actually had the art that each person did. We had it hung throughout the whole month of April. So not only did we have the art gallery, which, like he said, he was there, and actually he was our first chairperson. I just wanted to throw that out there too.
But very short amount of time. It was too far.
It's okay. You were there. But that was awesome, and we had over 100 attendees. So that event went amazingly well.
Well, we have a lot to learn from each other, to continue to learn from each other, because those are some new ideas that we haven't thought of. But next,
Can I add to that?
Oh, yes.
This is Madeline Santana from the board. We also have initiated, or had for, I think, 3 or 4 years now, the registry. We have
The Special Needs Safety Program, which is for first responders. Whenever a 911 call is made, they're able to see on there, which I know Miami-Dade County did something like that as well. And we have it specifically for Town of Miami Lakes residents. So when police or fire rescue, they go to a home, they know that there is also someone there with a special need, whether it be autism or anything else. So they know how to handle the situation. For example, sirens might be a trigger. Don't come in with sirens. If you see them run away, it's not that they're running from you. It's, so.
Thank you.
Yeah, I wanted to share a couple of success stories from this board. We lost David, unfortunately, but David, he's a blind resident. He's been possibly since the beginning of the board. He's been a member since then. I've learned so much from David and his experiences. And one of the things I learned, speaking from the city, is the difficulty of blind people navigating construction sites. They get used to the routes, they get used to getting to the bus stop, to work, to all their travel, and then construction happens and there are detours and they have no idea what information is out there. So with the push of David, David is on top of technology all the time, as he's been chair of the board many times, and he shares with me and with the board new technology that he finds, and we had a pilot with Aira. Some of you may know Aira, the app that speaks. You can use the camera and they tell you what's in front of you and they can describe anything. So we had that for a while for construction sites for when they cannot find their way. So that's something that was pushed by the committee. That was one of the success stories, I think. And now I think the convention center uses IRA as well. I know Miami Airport, which is not Miami Beach, but Miami Airport has it. And another story was, you know, in our procurement contracts, we call accessibility as a requirement, and we were purchasing the trolleys for Miami Beach. And however the process is, the lowest bidder, David is back.
Thanks, Valeria, for the shout out. I appreciate it.
So the other story was related to trolleys. So we got a vendor that was selling the trolleys with a back lift. So that's a lift for wheelchairs in the back. And they had 2 levels inside, so the person in the wheelchair or mobility device had to be strapped to the back of the bus. We were able to bring the transportation department to our committee meeting in the middle of the purchase process. And some of our members complained, and they shared their experience. They said, I cannot talk to the driver if I'm strapped in the back, if I have a comment, if I need something. And also the lift has a higher rate of malfunctioning. So the city was able to, with the push of the committee, was able to get the second part of the purchase of the trolleys with the ramp at the front, which is the same as Miami-Dade buses. The second half of the trolleys in Miami Beach now have the front ramp. So it doesn't mean like the back lift wasn't accessible, so we could have complied, but then we have the board that gives us their feedback, and now we know better. So that was another success story.
Wonderful.
So, hi. So I wanted to first share uniquely why I'm on the board, which is what we were speaking about before earlier, and I think this goes to a lot of the things that everybody was talking about as well. On our board, we have several different people that are appointed by the commissioners. I serve uniquely because I'm from the Chamber of Commerce. I didn't even know there was a board. So I went to the Chamber of Commerce and I shared the information that of the program I wanted to bring to the city and to use the businesses, I literally went in there for businesses, to do job tours for adults with autism. And when I was speaking to the then president, Mark Trowbridge, who passed away, he automatically put me on the board. He says this position's been open for 2 years. Nobody got on it and nobody was appointed to it. So he put me on there. So I've been learning a lot for the past year. And I just think that it's unique that the chamber put me on there and that I'm there serving. So now what my job is there is to try and figure out how I'm going to get the chamber to get involved with the board so we can do something for employment. That's like the big thing that I'm working on right now. But I do want to defer to Mari because she can tell you a lot of the different things that the board has done because she was on there for a lot longer than I was.
So hi, this is Mari Palacio. And Vanessa Livo has also been part of the Coral Gables board. I thank you so much for doing this. We've been talking to Elisa a lot about your board and how we can collaborate, and you did it. You actually got the plans together, so kudos to you. One of the things that we are really proud in Coral Gables was that we brought Project Victory to the city. Dr. DeRocher is part of our board, and that talks about exposing the government of the talents that we have, and it's important for everyone, for the city, and I'm gonna talk a little bit about the chamber and a little bit about that, and obviously the students that are there. Another thing that we did in Coral Gables was that we made an initiative to add a self-contained classroom, the first one in Ponce de Leon Middle School. We didn't have anything in the Gables. I mean, my son is 23 and he was never able to go to a Coral Gables school. That's when we created our own school later on. He's 23 now. So we're really proud of those very important successes that we've had. One of the things that I wanted to tell Commissioner Kaya is that one of the things that the city is doing is expanding the website to include resources for people with disabilities within the city. And that's extremely important. One of the things that I also do as part of the School and Community Relations Committee is that visiting other schools. And when I went to Coral Gables High School, a school that my son went, I realized if I move to the Gables, I don't know that this school has a program for special needs. I just don't know it. Because if I go to the website, you don't know these people exist. I mean, we've had city officials going to, and this is recorded, going to the Gables School, and they don't know that they have three self-contained classrooms or even 4. They just don't know it. So on Ponce de Leon, so this city website is expanding, adding these links to the schools, links to the Lighthouse for the Blind, resources that we have in the Gables that actually those resources can get you board members. Gables, South Miami has Area Stage Company. There's a lot of parents there with different disabilities, and that's another thing that she's here. They're here, Area Stage is here. So that's also very important, and one of the things that when we talked with Elise is key to have representation of all disabilities. Because, yes, I'm a parent of a child with autism, but you know how many times we talk about autism in our board in the past, and you see eyes rolling. Oh, there she goes again, and now it's the flag. Oh, and the flag is everywhere. Thank you to Commissioner Regalado. Awesome. And it's great. And then one day we're not going to need a flag because it's just given, and that's it, right? But it's very important. I mean, Vanessa has a disability. We have people with disabilities that are low vision. We have another one that had a horrible accident, and she's also mostly in a wheelchair. Katie is here from Parks and Recreation, and she actually is the one that directs that department. So again, I think that it also needs to start with the local government. Going back to what Eddie said, when we were pushing at the chamber level, why can we talk about disabilities? I mean, in October and in April, because we need employment for these amazing individuals who have a lot of talent. And I was told, okay, Mari, whenever the city starts, we can start. And it was kind of like, so, I mean, we talk about disabilities, what's the city's doing? Okay, so Coral Gables now has an autistic adult in front. Actually, it's the first face that you see when you go to the HR office. And that was through Best Buddies, and he's amazing. I mean, Brandon is great. Katie, do we still have one at the Adult Activity Center?
Something I'm really proud of, something our board started, but IRA is a visual wayfinding app. There's also an ASL app, and the city of Coral Gables is the only geographic location, municipality, city, airport, anything in the whole entire world that offers IRA to the entire geographic boundary of the city for free for any person inside the city. And our board, and we created that.
Nice. That's fantastic. I can't wait to hear more. We're missing one more person, right? Go ahead.
Well, for the city of South Miami, as new as we are, a couple years back, the city did vote, and we do have that registry for anybody with any autism or to register for it. Unfortunately, we just checked and nobody has registered, so it's been an awareness with our community and knowing the programs that are out there, so that our police department would be aware of any of these members within our community that has any special needs. And then the other thing that they're, as new as we partnered with Area Stage Company, that they're within our community, and we have a grant with them where basically they're offering scholarships for 5 scholarships for local residents within the city of South Miami with needs and looking for programs for the summer, 13 years and over, to incorporate them in the arts as well. And then we've done multiple local events for our community to drive this involvement in the arts for our residents of any special needs. So.
I just want to say something really quick. Just because a lot of cities started with the registries, but the one that Miami-Dade County runs 911, so we own the 911 system and we push it out to everyone. So the registering with the county one can ensure that everyone gets it through 911. If you just do your city, then only like they have access to that. So the sheriff is trying to figure out kind of like how we get that data and upload it to the 911. But the issue is that our registry is more extensive, right? So it asks a lot more questions, and that's kind of like the disconnect. So, one of the things we're trying to do now that she's also doing the car registration is to get everyone to understand that while this started at the municipal level, like it really is safer for everybody to do it like on the county level, just because you don't stop at the municipal, like stop, right? So the same thing with the training, trying to get everybody to do the training. And then also to use that information that the municipalities have to turn them into outreach for these boards. So, I mean, that's good data, right? And you could still use it. You just kind of morph it, you kind of feed it into the county one, and you could still use it. It doesn't hurt to have both. But for longevity purposes, it's better to have all that information, whether they're verbal, nonverbal, what's their particular de-escalation, what are their triggers, right? And have that accessible to everyone. And I'm actually working with Broward to do the same thing, to mirror the Miami-Dade County one. So that the two are the same, because there's a lot of people who work in Broward or live in Broward and work here. So we are a region, right? Like, I'm a county commissioner, but we are a region. And there's a lot of work that I'm trying to do for the region, so that our kids could be safe in the entire, our kids are adults, I call them kids, in the entire region.
And then for the city of Doral, we've only been around for a very short time, but I think our biggest thing and our most popular thing, our most attended meeting is in April always, is our summer camp that we created for 7 and up. It's a very small program, only 15 children or adults for the adult side are allowed in each classroom, but every year it fills up. It's 5 weeks, and it's only $200 for our residents. So it's very, very popular, and I think that's our biggest accomplishment. And this year we rolled out swimming lessons because we opened up our whole new water park and pool, and so swimming lessons are also starting this summer as well for disabled children and adults.
It's a tall list to try to achieve. I would like to add one little thing, but it seems like everyone tapped into funds, right? Something difficult. I just wanted to point out that this amazing success we had with having a person assigned, part of their job description is assigned to help us at the village level represent those with disabilities on Key Biscayne. That was not something that was new to the budget. When you talk to someone about a budget, they're, oh, the budget's full. No, the budget's full. No, can't do it. Maybe next year, whatever. What happened was that we were able to talk about reallocating funds that were already in the budget. So if someone tells you it's not in the budget, not this year, please take a little look at it. We went to the budget meeting, we learned what the budget items were, and this is where we learned that there was possibility for them to reallocate. Then that's what we did. We asked the mayor and council members to vote to reallocate funds, to reallocate funds that were already approved and send a little bit our way. So don't be discouraged if they say it's not in the budget. Find another way for it to be in the budget.
That's how we got our swimming lessons.
Oh, you did?
From the Parks Programming Department. We just took some of that, and that's how we...
Can I add to that? So in the city of South Miami, I'm really big on looking for grants, and we've hired grant writers, and to me, it's just a great ROI. We found this first grant with Maria through Area Stage. Now, since we have a grant writer and we've made this something very special for our city, we've applied for another grant, and we're a finalist. And what I'm trying to tell you is get with your elected officials from each city, from each county, and tell them to look for grants. And what the city does is we match it, right? So the city will match, for example, in this grant we have to match $40,000, but it's in kind. So when we do events, when we do anything, that really counts for it. It's just labor, but we're doing it anyway. So it's easy for us to go get those grants. So I would tell you, start working with your municipalities and figure out how we can go get more money, because it's out there. We just got to go look for it.
It's encouraging. I'm going to add something. There's also like different programming that's available. So the Red Cross came to the county with a Zero Drowning Initiative, and it didn't speak of autism. And I amended it and educated the board on how the #1 cause of death for autistic children and adults is drowning. And I was like, this is great, zero drowning. Can we start with autistic people, right? Can we talk about neurodiversity and how people who have sensory issues, are attracted to water? So they allocated a certain portion of that budget just for this. And now the Children's Trust also has funding just for this programming that James has expanded. And they have a group that meets on that. So, for the zero drowning, we've been finding locations and finding swim instructors that will do this. The same thing with Special Olympics. Special Olympics used to be a lot bigger in Miami-Dade County prior to the pandemic, and then it kind of like wound down. And now we want to do more, but we don't have the humans that want to do the training. So, there's that. Miami-Dade also has great programming like All Kids Included. I love All Kids Included. I have to drive very, very far to take my kids to All Kids Included, and now they're aged out, so they're very sad. But I was asking for a long time to do something down south because there's nothing down south. So now we opened a brand new program in Homestead, but it was very challenging to get people to go. So, you can also reach out to the Department of Cultural Affairs. You can have organizations, apply for funding from Cultural Affairs, even though every year it's like a dumpster fire trying to get the money in there. But that being said, there are programs that are being funded county-wide that cities can access. And it's just a matter of saying, hey, also this population, right? This is our idea. This is how we fit inside this existing programming. And sometimes it's about finding space, right? So if you have a space that the county doesn't want to pay for space, right? So you can, if you have a space, you're going, hey, I have a space, right? You can bring them here. Michael was talking earlier about our museum partners. I don't want to gloss over that because the training that UMNSU CARD has done at our museums is phenomenal. Because similar to the libraries, now they have become incubators. So Frost hires neurodivergent adults. Neurodivergent adults, work there. And Super Glue, which was the first one, also the same thing. And then they also do free Saturdays and free events. And if you look, they have sensory, activities. To Mari's point, our kids, and our adults need to see people like them. I'm talking to Palmetto Bay and Pinecrest about doing something similar. It might be like a task force. We've been talking about it for a while. But Karen Cunningham brought up a very good point. She's the mayor of Palmetto Bay. She has a nephew with multiple disabilities. And she was mentioning the other day when I went before them that her sister-in-law was like, she moved here and she was like, where are the people with the disabilities? I don't see them. Where do you guys hide them? And I realized that, it's funny because you don't see it that way, but we're always scanning for them. Right. And when you see them, you're like, oh, safe space, So, that's the other thing that I think, we talk about the chambers and I think that's important, but I think we also have to change the conversation and educate realtors about schools and educate, all the different stakeholders that get asked the question. Right, and that's kind of like a bigger thing. But there is county-wide services and programming that's available. We do neuro-inclusive Saturdays where everybody gets to come by. I am constantly shocked that parents don't know that you can get a Florida ID starting at 5 years old, and that now the state of Florida allows you to put your disability on there. It is shocking to me because we've spent 15 years fighting with the state of Florida so they'll let us voluntarily put a disability on an ID. And how important it is for parents to know that if they have a Florida ID that has a disability on it, it will change your life in so many different ways, because now you don't have to like try to prove someone that they have a disability, because all of you have been on the other side of, is she still autistic? Yeah, for life. I'm like, what do you mean I have to pull out my diagnosis? That was in 2003. But those are the things that happen to you, and you're mind blown, right? Because you're like, yes, I am the parent. How do you not see it? So there's a lot of stuff out there that is so important, and you can ask the tax collector to come out to your city, and you can get your people there. I do a neuro-inclusive event every year at Betham, and we try to get people there, and we bring all the resources, but people don't like to come from all over the county. It's like a thing. So, that's a very simple ask that you can make of your cities. Like, hey, when you have an event, have you considered, being sensory friendly? Like now the county is working, and I'll shut up with this. The county is working on July 4th. And everyone is on, they made a committee and all this stuff. And I love July 4th. Okay, I'm a neurotypical person, I love July 4th. But people don't like it. Okay, they don't like the fireworks, they don't like it, it's a scary thing. It's hot, there's a lot going on, so I try to educate people on, like, wouldn't it be great if you did drones? Wouldn't it be wonderful if we did something a little on the light, So those are all things that when you choose your activities, just remember that there are other people that may not, what you consider a celebration may be scary to them. And that's something that we need to bring to all of these conversations and bring it up, like, hey, where are my kids going to go? Where are our kids going to go? Where are they going to feel safe? Because a lot of times people just don't know. And they think that the way that they celebrate and the way that they have celebrated is the way that they should always celebrate. And that's not necessarily always, do you have a quiet space? Is there an air-conditioned place for people to go? Are you having it inside? Are you having it outside? All those things.
I would like to mention to what Commissioner Regalado said, we've partnered with Miami-Dade County, I want to say it right, Miami-Dade County Department of Cultural Affairs, and we have, in Miami Lakes, ages 22 to 30, we have animation arts, and it's for
fantastic.
Yes, with autism spectrum disorder, intellectual and developmental disabilities, and also 4th of July, at where we hosted, which is Veterans Park, inside of the community center, which is Mary Collins, we have a sensory room. So it's air conditioned. We actually give out, like for free, we just give it to them, noise canceling headphones. But within the room, we also have puzzles. Last year we didn't have it, but we've had it before, where we also have a screen where they can see the fireworks if they want to see it inside. And they also have, like I said, the noise canceling headphones, they can color. And then part of the room, we have it like kind of dim. And we have some bean bags if they want to go sit on the bean bags. There's like little lights, then we have puzzles. So we also do that for 4th of July.
On our board, we have a similar thing in 4th of July, and I think that we really, with the events and everything that we try to do, we do try to do them pretty much inclusively and make sure that everything gets properly done. And I'm going to defer to, if you don't mind, to tell us about the July 4th, because she is so excited about it when she talks about it. But you have to hear this.
The city's 4th of July event is held at the Fillmore Golf Course, and it's 50,000 people on the golf course. There's nothing I can do to change the sensory experience. I can walk through any barricade. I can make anybody change any rules that I want. I have almost unlimited freedom to change the situation, and there's nothing I can do. It's 50,000 people on the golf course. Those are hard limits. So what we did, I have a small building directly across from the golf course. And we moved the whole thing there. So we have sensory-friendly 4th of July right across the river. And we can still see the golf course. We're still part of the community. But things that we have on-site parking. You don't have to hike an hour and a half to get there. You can show up at 7 o'clock instead of 4 in the afternoon. And then we have a full indoor building. And then what I do when it's time for it to start, fireworks start around 9, at 8:30, I start a fire. So what I do, I get everybody sitting in one spot, calm, and in position, and we roast marshmallows, and then I leave all lights on, so there's no like sudden, when you're at the 4th of July and all lights are on and everybody's happy, and then all of a sudden lights are off and there's bang, bang, bang. So I leave lights on, we have a fire, the city now does drones, which is really nice for us. And then I still leave the lights on, and by the time the fireworks start, everybody's relaxed, everybody's know what's happening, and it's just that like sudden change is not there, and it's so calming. We had 150 people with sensory disabilities in Park last year, not one single person cried. Oh, good job.
It's, I had to have her say that. It was really great. But the whole thing is that you don't separate. You include, but you include it in a way that's like the same thing you did, but just keep them included and keep them coming to the events. That's really important. The other thing that I wanted to mention is I know that we're talking a lot about employment and thinking about that in the future because everybody's going to have to deal with it at one point. And I think that the important thing is to expose a lot of the employers to the young adults with autism and adults with autism, because not only do the autistic community have to get used to the employers need to get used to hiring them too. And I think that's really a difficult thing. And I've been doing a lot of like business relations and trying to get job tours and get the kids out and everything. And I got to tell you that after 4 years, yesterday, it was Friday. It was the first company that told me, oh, but we also want to train. And I'm like, what? And I didn't know how to answer because it was like the first time it happened. And that's really what I'm trying to look for. So I think that the broader conversation of everybody talking about autism and sharing that and what we're trying to do here and bringing in the businesses. So I hear there's a lot of things that people don't know about these programs, but maybe there's someone that does advertising or promotion in the area that everyone has somebody with autism in their family. So maybe bringing them into something like that they can help promote those types of programs and to sign up on a pro bono basis would be a good thing from the business standpoint. Vanessa wanted to mention something too.
I just want to chime in. I love that everybody's been talking about setting up the city and the foundation on how to set up a city more, accepting and inclusive. But what I do want to also say is that we also have voices as advocates immediately. During the pandemic, one of the things, the city of Coral Gables was the very first city in the nation to add an amendment to the mask mandate. And that was for individuals on the spectrum. And that happened the very next morning. And that was because of the champions that we have on our board, because of the individuals and the experiences that we have. Furthermore, during the pandemic, another issue that we had was working with Parks and Rec, actually was with Katie. And I'm going, wait a second, what does the deaf community do? All of a sudden, everybody just went on mute. And I thought of her, and the city instantly was so accepting. We went door to door, and to all downtown, we gave clear masks, so that people could see what was being said when they were being spoken to. So those are immediate, instant issues that we can bring up as advocates, as appointees, and it's something that, yes, we should always look at the foundation of the city, but also really think about what we can do in the immediate instance. Thank you.
Yeah, the important thing is that you're, I'm sorry.
No, audible crosswalks. That's what we're working on right now. Audible crosswalks is another thing. So yes, there's many successes, and I love hearing everybody's successes in the city.
And yes, the thing that they keep mentioning also too, and if you keep hearing, we keep talking about different disabilities on the board. So it's kind of funny because although, yes, we do talk about, Madi and I talk a lot about autism, there are other people on the board that have different disabilities personally. So it's interesting to me, and for the past year, I mean, I've been dealing with autism since my son was diagnosed at 13. And this is a long time ago, he's now 29. But, and to hear all these other disabilities, and maybe it's something that I didn't even know about. I mean, it's all the audible crosswalks and all that kind of thing too. I hear them, but I didn't know that we didn't have them. I mean, there was 1 or 2 or 3, and now we're trying to get them all along Miracle Mile and the prime spots too, which is a really important thing to do.
Well, one of the hardest things I've had to do is wrap this up. We're a few minutes over schedule, but on behalf of the Disability Board of Key Biscayne, we would deeply, deeply thank you for being here. All of you are VIPs. All of you have so many fresh ideas for us. I know I'm walking away completely inspired and eager to just try everything that you've done and continue our dialogue. And there are other people that we need to thank. Juan, our interpreter, and his assistant. And we also have to, we can't, stop without thanking Todd Hopperberg. He's surprised. He is our liaison with the village, and he is responsible for organizing our meetings and actually getting this room going for us tonight. So it was a great accomplishment. Thank you, Todd. And thank you all for coming again, and I hope that you're interested in meeting again periodically. Our dream would be to have a summit in person once a year, and maybe meet every 3 months through Zoom, and just bounce back ideas and see how things are going and help each other out. So Yes.
Welcome in Miami Beach anytime.
So again, thank you deeply from the bottom of our hearts. One more question.
Will the Zoom meeting be available for later?
Will this be available to review? Yes. I hope so because my notes are very messy.
I'll also be sharing with Elise our flyer for our disability anniversary celebration. Or the county does their own as well, but I'll send us.
I'm gonna have a big
Thank you.
October rollout, so stay tuned.
Thank you, everyone. Have a wonderful evening.
Awesome, thank you.